We will now demonstrate the well-positioned eye. Notice the crosshair is centered in the pupil. It is important to center the crosshair vertically. For a smaller pupil, you want to make sure that the crosshair is centered both vertically and horizontally. If the crosshair is in the center of the pupil, then the patient can see the green ball. The limbal ring should line up with the outside of the iris. When the patient is in this perfect position, instruct the patient to click the hand switch button and capture the image. If you want to check to make sure that the external camera was correct, go to Image, Exterior Eye Image, and please note the crosshair is centered vertically with the limbal ring right around the iris. The patient should have seen a small red circle all the way around that green dot. Now we'll close the exterior eye image, and we're going to use the gamma function to lighten the image. This is a beautiful ultra-wide field image. Please note that the eyelashes on the image are the upper eyelashes. The only way to get rid of the eyelashes is to tape them before capturing an image. I will now demonstrate a patient that is too far in. Please notice that the crosshair is in the pupil, but that the iris exceeds the eye camera ring. The patient sees a very thick red halo. I will now instruct the patient to capture the image. We'll go to the image and bring down the exterior eye image, and as you can see, the limbal ring has clipped the iris. Now I'll close the external camera, bring up the gamma, and you can see here, this is what an image would look like if the patient was too far in. The solution would be to move the patient back from the instrument or increase the inflation in the eyepiece if that doesn't work. Have them confirm verbally that they can see a normal amount of the red halo and re-image the patient. I will now demonstrate a patient that is too far out. Please notice that the crosshair is centered vertically on the pupil, but that the iris does not fill the eye camera ring. The patient will see the green dot, but the red halo will be very, very thin. I'll now instruct the patient to capture the image so we can see what the image looks like. If we bring down the exterior eye camera, you can see that that limbal ring was not all the way around the iris. So we'll close the camera. We'll bring up the gamma, and you can see that there's a dark area all the way around. This shows an image where the patient was too far back. So the solution would be to move the patient closer to the eye pillow by applying gentle pressure to the back of the patient's head to secure their eye closer to the eyepiece. Have them confirm verbally that they can see more of the red halo and re-image. I will now demonstrate a patient that is too high. Please note that the iris appears higher than the limbal ring. The crosshair is still in the pupil. The patient will see the lower part of the red halo only. I'll instruct the patient to capture an image so we can see what the image looks like when the patient is too high. Let me bring down the exterior eye image, and as you can see, the crosshair is centered vertically, but the iris is higher than the ring. Let's close that and use our gamma. And as you can see, you don't have a wide field view This will look like this on the bottom of the image when the patient is too high. The solution is to increase the height of the table and recapture the image. I will now demonstrate a patient that is too low. Please notice that the crosshair is centered vertically on the pupil, but that the iris appears lower than the limbal ring. Patient will see the upper part of the red halo. I'll now instruct the patient to capture an image. Let us bring down the exterior eye image so that you can see where the ring is in relation to the iris. The iris is lower than the ring. Let's close that and adjust the gamma. And this darker color on the top of the image demonstrates an image where the patient was too low. The solution for this is to lower the height of the table, and if that doesn't work, to adjust the patient chair by lowering the chair and recapture the image. I will now demonstrate a patient to far right. Please notice that the iris appears to the right of the eye camera ring. The patient will see only the left part of the red halo. I'll now instruct the patient to capture the image so we can see what the image looks like when a patient is too far to the right. Let's bring down the image and the exterior eye image, and you can see where the ring is over here and the iris is too far over to the right. If we bring up the gamma, you can see that this green border is to the right of the image, and we do not have a very wide field of view. The solution is to move the patient's chair to the left or guide the patient's head position and recapture the image. I will now demonstrate a patient to far left. Please note that the iris appears to the left of the eye camera ring. The patient only sees the right part of the red halo. I'll now instruct the patient to capture the image. If we bring down the exterior eye image, you can see that the iris is to the left of that limbal ring. When we use the gamma, you can see that the green border is to the left of the image. The solution would be to move the patient's chair to the right or to guide the patient's head into the correct position and recapture the image. I will now demonstrate a person blinking during the capture process. A blink will appear as spikes on the image due to the image capture speed. Some patients may blink automatically as they press the capture button. I'll now instruct the patient to blink. My image, you can see we actually caught the patient closing their eyes during the blink. When we adjust the gamma, you can see the spike here represents the blink, and we did capture just a tiny bit of the retina. The solution would be to allow the operator to press the capture button, or to ask the patient to blink real quickly 3 times, then hold their eyelids open. I will now demonstrate a patient who captures an image while their eye is closed. Let's bring down the external eye camera, and as you can see, their eye was totally closed. When you bring up the camera, you'll see that you didn't get anything on the image. This is what it will look like when the patient's eyes are completely closed.